Ողջույն, առողջության պահանջ.
звонок может быть
Permitir a su intérprete repetir.
Kuch batein batlanna chahte
With the increasing diversity of our population, healthcare providers and patients often face language barriers. Chances are, in your practice, you'll encounter patients who are limited in their English proficiency and deaf patients who request interpreter services. Communication problems are the most frequent root cause of serious adverse events, and patients with limited English are more likely to suffer the worst outcomes: permanent loss of function, deaths, and near deaths. More often, communication barriers delay essential treatment and diminish the trust between you and your patient. The challenges are greatest when the patient speaks little or no English, cannot hear, or when provider and patient are separated by cultural differences. Without clear communication with our patients, we cannot deliver the quality of medicine we're committed to. I'm Dr. William Walker, and I'm the Health Director in Contra Costa County in Northern California, and I'm also a practicing primary care physician. In my practice, I've treated patients from dozens of different national and language backgrounds. I haven't always had the resources at hand to provide optimal care. We've always known that effective and accurate communication is important in every aspect of healthcare. Studies show that 60% of the information that goes into a diagnosis emerges from the medical interview between provider and patient. Effective communication is equally essential to educating patients about their conditions and developing treatment plans that patients will follow. Consider how challenging communication can be even before language or cultural differences enter the picture. Successful management of many of the most common conditions, such as diabetes and heart disease, requires that our patients learn new terms and concepts. For instance, telling a patient that he needs to have better control of insulin levels or limit intake of carbohydrates won't work if the patient doesn't know what insulin is or what carbohydrates are. Now, if that isn't difficult enough, consider the patient who doesn't understand spoken English very well. How do we ensure that this patient has equal access to equal care? Accrediting organizations like the Joint Commission are certainly asking that question and have strengthened their oversight of language access programs. Legislation and regulatory standards require that interpreting services are provided at no charge to the patient. Clearly, the message about the importance of language access is being delivered from many sources, and we can begin to understand the value of using the right communication tools in administering care and services to all of our patients.
I'm Dr. Gina Gregory Burns, and I'm an internist on the Spanish bilingual module at Kaiser Permanente in San Francisco. I'm also the Chief of Diversity in San Francisco, as well as for the Northern California region. If you're like me, you may have used an ad hoc interpreter before, a bilingual coworker you borrowed from another area. It saved you time, but what is it medically accurate? It is clear now that it's unrealistic to expect bilingual employees to make communication complete and accurate between providers and patients if they are not trained and assessed for their ability to perform in this capacity. There is also a growing awareness that relying on family members of any age for medical interpretation is problematic. It violates a patient's right to confidentiality and unfiltered access to information. Fortunately, now it is easier to access healthcare interpreters and incorporate professional interpreting services into your delivery of healthcare. This will improve patient safety and health outcomes, comply with language access requirements, and improve patient satisfaction. Be sure to check with your organization's administrative policies and procedures to see how interpreting services are being delivered to your hospital or clinic. Ask, too, about what you should do if you need a document translated, because interpreting is a verbal skill and translating is a written one. There may be a separate service that will help you get your documents translated. Our trained and qualified interpreters are our partners in the delivery of care to limited English proficient and deaf patients. To help explain interpreting in a healthcare setting, I would like to introduce my colleague, Gail Tang, who is an expert in this field.
Healthcare interpreting has come a long way. It's a rapidly growing profession with both state and national healthcare interpreter associations informing standards of practice and code of ethics. I'm Gail Tang, and I'm the Director of National Linguistic and Cultural Programs at Kaiser Permanente. There is a body of knowledge, skills, and abilities required of a healthcare interpreter. So, for instance, if the patient starts talking to you, educational opportunities in this field are growing. Training programs in both interpreting and translation are now offered in a number of colleges, universities, and community-based agencies. Some hospitals have interpreter training programs for their bilingual staff.
Trained healthcare interpreters follow basic protocols that have been agreed upon in this profession. Interpreters abide by hospital standards of confidentiality. Interpreters will repeat everything you say in the patient's language, and they will repeat everything the patient says to you in English. When it's done right, it's a lot like speaking to an English-speaking patient. Trained interpreters will be careful not to add anything, omit anything, or change the meaning of the message.
What brings you into the clinic today?
¿Qué la trae hoy a la clínica?
Me duele mucho la cabeza.
My head hurts.
A trained interpreter will want you to speak directly to the patient and not to the interpreter. The interpreter will speak in first person in order to make the conversation more direct between the doctor and the patient.
Have you had this issue before?
¿Ha tenido este problema anteriormente?
No.
We encourage you to say directly to the patient, "Where does it hurt?" instead of speaking to the interpreter and saying, "Ask her where it hurts." You will need to pause after each sentence or brief thought in order to give the interpreter a chance to render the message to the patient in his or her language.
Normally when we see these types of symptoms,
Normalmente cuando vemos este tipo de síntoma,
they're often related to stress in someone's life.
muchas veces está relacionado con estrés en la vida de las personas.
Have you been experiencing stress in your life lately?
¿Ha experimentado algo que la estresa últimamente en su vida?
If the interpreter needs clarification, he or she may say, "Interpreter has a question," or "Interpreter would like doctor to explain." This can be done with you and or the patient. A qualified interpreter would make clear who is speaking at the time and make sure that all parties know what's going on at all times.
Interpreter ethics require that everything said is interpreted, whether it comes from you, the patient, a nurse who steps into the exam room, a family member who interjects a comment, or any other individual present. Interpreters do this because they want to keep everyone's trust by making sure that no one is left out of any conversation. Imagine for a moment that the patient understood English. Everything in the room would be heard. If an interpreter has difficulty understanding something, he or she might say,
Doctor, the interpreter would like clarification on that term and see if you could explain it to the patient in different words so that she can understand.
The interpreter will also let the patient know that he or she asked you for clarification. Help your interpreter by rephrasing the question or statement. Sometimes an interpreter will say to you,
Excuse me, doctor, the interpreter doesn't understand one of the terms that she's using and I would like to ask for clarification. Señora, ¿qué quiere decir usted con hierba?
If you don't understand the interpreter's delivery of the patient's response, it may be that your patient isn't very clear. Ask the patient, through the interpreter, to explain again. To check your patient's understanding of your instructions, you may want to say, "Please tell me in your words what I've asked you to do." The interpreter will render your question to the patient and the patient's answer back to you.
There are some occasions when an interpreter believes there are cultural issues or experiences that are the cause of a problem in communication. In these instances, the interpreter may offer a clarification. For example,
there might be a possibility that there is a cultural and religious opposition to blood transfusions.
the interpreter will check this observation with the patient to ensure that everything said is said in both languages and to avoid engaging in stereotyping or generalization. Also, the interpreter might offer or ask for cultural clarification. For example, informing patients of risks in their course of treatment is a legal obligation of physicians working in the U.S. healthcare system. For doctors, it is routine. An interpreter, however, may detect confusion in patients when they respond to being told about the possibility of a procedure causing infection, damage to surrounding organs, and even death. In this example, the interpreter might say, "Doctor, the interpreter would like to share that the patient's mother may not be used to a doctor describing the risks of surgery, and that may be why she is refusing surgery for the baby. Could you please explain what might happen if there is no surgery today?" The interpreter will check this observation with the patient and not make any assumptions. The interpreter is an integral part of the healthcare team. Remember, the role of the interpreter is to facilitate communication and understanding between you and your patient when you don't share the same language or the same culture.
When we don't share the same language with our patients, it's very important to work with an interpreter. Having someone qualified to bridge our communications ensures safe care of the patient and improves health outcomes, not to mention patient satisfaction, and compliance with language access requirements. I'd like to now turn to my colleague Beverly Truman, who will guide you through the latest technologies used in quality medical interpreting.
I'm Beverly Truman, and I'm Program and Quality Assurance Director for the Healthcare Interpreter Network. I'm also a Spanish interpreter. I worked for more than 10 years in hospitals and clinics helping patients and doctors communicate with each other. New systems, new applications, and even new technology are making it easier to access trained and qualified interpreters 24 hours a day, 7 days a week. Your hospital or clinic may provide you with an in-person interpreter who is on staff or contracted via an agency, or a remote interpreter whom you may access by telephone or video. In-person interpreters can be especially helpful for challenging encounters or an end-of-life discussion with a group of family members. Almost every hospital will have a contract with a commercial telephone interpreter service, which can typically provide interpreter services 24/7, often for more than 100 languages. Hospitals make effective use of remote interpreters when they choose the right telephone for the right situation. In many locations, a good speakerphone is the best choice. A speakerphone allows other people in the room with the patient, possibly another healthcare professional or a family member, to use the interpreter comfortably. If two people need to communicate in a public area, say a single patient and a pharmacist, or a patient and an admissions clerk, dual handsets connected to a single telephone line facilitate conversation and ensure privacy. Often, a simple splitter available at a nominal cost, an extra handset and a cord are all you need to change a regular phone into a dual handset telephone. Many hospitals and healthcare systems are also using video conferencing to provide access to interpreters. The technology for routing calls is fast. The image and sound has improved and it's become affordable.
Good afternoon, this is Yvette with the Healthcare Interpreter Network, CC105. How may I help you?
With recent improvements in technology, video interpreting has emerged as an option that best approximates the in-person experience. As with telephone systems, video-based interpreters can be reached on a moment's notice, offering access to languages that the hospital may not have on staff, such as Vietnamese or Korean. The advantage of video is that the interpreter can utilize visual cues like facial expressions and gestures, in addition to the spoken word. This improves communication and helps the patient feel at ease. Of course, video interpreting is critical to accessing American Sign Language interpreters for the deaf. especially when in-person ASL interpreters are not readily available. Remember that not all deaf patients will use ASL, so it is important to ask those patients about their language preference. In remote interpreting, such as video or telephone interpreting, the interpreter will follow many of the same protocols as an in-person interpreter, but because they are not in the same room, they will need some additional orientation.
Hi Maria, my name is Dr. Tai. I'm calling you from the Family Practice Clinic. I have Mr. Gonzalez and his family member here. Can you please interpret for me?
It is helpful to tell the interpreter where you are, what specialty, and a little bit about the purpose of the appointment. Tell the interpreter who else is in the room. When you have completed a medical encounter using an interpreter, the assistance of an interpreter needs to be recorded in the medical record. Even if you are using an interpreter or trained bilingual staff member provided by your hospital or clinic, the person's name should be recorded. If you are using an interpreter remotely by telephone or video, they will provide you with an identification number which should be recorded in the medical record.
My number is CC904. How can I help you today?
Depending on the policies and procedures at your location, you may need to write down a name or number, the language, and the means you used to access the language service. Was it by phone, video, or in person? Documenting the use of an interpreter is especially important for critical forms of communication, such as informed consents. With all the technologies available now, you can access a qualified healthcare interpreter within seconds and provide excellent medical care to all of your patients.
As we have seen, trained and qualified interpreters are our partners in assuring that we can communicate with our limited English proficient and deaf patients. With a combination of rapid technological advances and an adherence to professional and ethical interpreting standards, we can depend on these partners to facilitate accurate, quick, and complete communication with all of our patients.
As providers, we understand the pressures of the fast-paced medical environment. We also understand the importance of quality care. By incorporating the appropriate use of linguistic services into our everyday practice, we are acting to ensure that we provide the highest level of care to all of our patients.